Our first panel today will explore telehealth, which is the use of electronic information and telecommunication technologies to support long-distance health, clinical health care, patient health, literacy, access, and self-management. Support from payers continues to evolve and grow, and adoption by hospitals is around 76%, but overall utilization by patients has been quite low. Our moderator for today's session is Joe Goff, Board Director for Sonic Ventures. Also on our panel is Dr. Stephen Shaya, Managing Director at J&B Medical, and Chris Bailey, Director of Business Development at Velatura. Please take a look at the back of your program. There's a code that you can scan for all of our speaker bios today, as well as the presentations that they're sharing with you. So let's go ahead and get started looking into telehealth. Thank you.
Well, welcome everybody. The microphone certainly works. I would like to start out, I'm a big fan of the Transcendentalists, and Henry David Thoreau said that the cost of anything is the amount of time in your life that you exchange for it. So I'm going to try to jump right in and not exchange too much of your time for any empty introductions. But we have an esteemed panel here with us today to be discussing these telehealth issues. And really quickly, by a show of hands, how many people were not born when the Detroit Tigers won the 1968 World Series? So about that same time that Mickey Lolich was winning that third game, the University of Stanford was running the NLS computer science program, the first video conferencing of a telephone call. And it was immediately transferred into Stanford's health and medical program for one of the first use cases. So that 50-year scope is how long telehealth technology has been open and available to us. And we are just kind of now coming into the moment in time when it is being applied with its highest amount of efficacy towards our healthcare goals, especially as a system of healthcare and an ecosystem of digital tools. So with that as kind of the primer, I'd like to hear introductions both about your past and your successes and your perspective on telehealth that you're going to bring to this conversation today. So I'll start with you, Chris.
Good morning, everyone. Chris Bailey, Director at Velatura. My background has always been in healthcare, project management, lean, Toyota production system. Spent a number of years at Ascension Trinity implementing EMRs. Last 5 years I've been implementing telehealth. I don't think it's been around for a long time, and it's not moving fast enough. And I think that's the technology's here and it's evolving, but I think it's still the question of people, process, and technology. I think the people and process have to catch up.
My name is Stephen Shia. I'm a family practice physician. And before I describe myself, I first wanted to thank my wife, Samantha, who's home with our 3 children, Adele, Grayson, and Gavin, 6, 4, and 2. And hopefully that gets recorded. And I need all the brownie points I can get. I'm a family practice physician by trade. I've done about 100 deliveries of babies in my career. My family owns a company based in Wixom, Michigan called J&B Medical. My mother owns 51% of J&B. My father owns 49%. So we say my mother's boss at home and at work. But we have 17 different business enterprises. We run the gamut from medical distribution to specialty distribution. Most people know us as one of the largest third-party billers of consumable medical products to the homes of the United States, diabetic supplies, wound care, ostomy, insulin pumps, continuous glucose monitors. We also have a telemedicine company called HNC, Virtual Care Solutions. Had a very interesting beginning. About 10 years ago, my dad and I were sitting having breakfast, and my dad says, "Son, telemedicine will be big, son." I'm like, "Dad, you're probably right." He's like, "Son, we be big in telemedicine." And I'm like, "Dad, you can't turn your computer on enough." But it certainly didn't deter him, and today We are taking care of millions of patients globally. The project I always like to talk about is one we're doing in Pakistan. We're taking care of over 1 million mothers and children today, never had access to health care. That's scaling to 8 million lives. We're starting a similar program in Mexico where we're going to be taking care of over 500,000 mothers and children, never had access to health care. A lot of different use case scenarios that we'll talk about in this panel. But my perspective is really from a provider's perspective, whether it's telemedicine, telehealth, video conferencing, sensors, mobile apps. We're all going to be in a connected health environment moving forward. And for those of us in this room that embrace it and really try to develop a connected health strategy, I think that will be a huge leg up because everything's changing very rapidly. So thank you again for the honor and privilege of being here today.
Thanks, Stephen. The first question that I'd like to start out with is telehealth has taken on over the years an almost science fiction role in medicine and communications in general. But we're starting, as we discussed in the opening, to see the ramifications of that in real life and actually adding to the quality of life of human beings. So my question is, how do you see the next phase evolving? The future of telehealth is going to bring what rewards to the average citizen, the average patient, and member of a health plan? And then, in correlation with that, what also is the non-traditional use case, right? The oddball use case that you think is going to emerge and become something of note?
Well, first of all, a couple things. Number one, I truly believe that the next iteration of telehealth is really integration. So a lot of people ask me what innovation is in healthcare. I always say it's integration. And that's been a big problem. I know it's something Tim and his team have been actively working on, getting all the key stakeholders. But the more that telehealth applications and use case scenarios become part of the actual flow, and it's not a separate flow. So let me give you a real life example. Just about every medical device today has some sort of Bluetooth capability, some sort of telehealth capability. The problem is every single, whether it's a continuous glucose monitor or a kangaroo pump, or they all have their own platform. So the last thing you want is to have 20 different portals that a provider has to go through to do anything. So that's been one of the challenges. I do feel that more and more, folks are trying to integrate and therefore will be able to innovate. If you ask patients, are you willing to share some of your medical information in return for lower premiums? Over 85% say absolutely. So I think one of the issues we're going to have to think about HIPAA a little bit differently. I think people are going to have to opt into some of these programs. That's one consistent thing that we've seen with all of our programs. The folks that opt in do much better, and it makes sense, right? They're more motivated. They're going to opt in versus trying to mandate something that they're not going to actually use. The other thing is that more and more there's this big paradigm shift now that's happened over the last 20 plus years. It went from patients to members, now it's consumers. People want access and they want convenience. Last year there were 60 million virtual visits. By 2020, it'll be over 1 billion virtual visits. So it's on a tremendous trajectory. So I really see it's a confluence of the incentives starting to align, the rise of consumerism, more integration, reimbursements and incentives aligning. So it feels like everything's simmering and it's just going to take off.
Yeah, I agree with that. I also believe that care will be coordinated, triaged, and often treated with this device. And there's really no way around it and no way stopping it. I also think that we have to agree that on the problem and see the opportunity. Certainly, telehealth allows two individuals to connect. But what are they trying to connect for? Are they just trying to solve a one-time question? Or are we putting in a process that helps patients with patient literacy and access? Because I think that's the promise of telehealth and virtual care, is that we help educate consumers. We have a feedback loop much like my family truckster is a Buick Enclave. I have a manual on how to operate the car in the glove box. I have a dashboard that gives me instant feedback on what's happening, and I have an OnStar button. And I don't have that in my healthcare. So I think one of the challenges is providing the right technology model strategy with the right features, but also building the right business model where both provider and consumer can win, and they have that feedback loop so that we're using resources, the right resources at the right time for the right level of acuity with the least amount of patient energy. And I think that is what will show the promise of telehealth.
Yeah, Chris, I want to stay with you. The wonderfully complex world that we live in of regulatory environments in healthcare has started now to loosen the grip on the reimbursement models for telehealth. So if you could tell me what you see as the near-term kind of happy accident of our reimbursement schedule coming downhill, and then what you see as hopefully the next step that will open up telehealth to more consumers, as you said, to give them more access in a mobile environment.
Sure. I'm no expert on all the reimbursement policies. I'm still learning, but I definitely have seen a shift. I think we all have noticed a shift of loosening the originating site requirement. I think a lot more work can be done on who can see that patient at what level in their care, right? Because patients really are the ones who are burdening the risk of their care. Most patients, they sort of know what their symptoms are, but they don't know when to press the button, pick up the phone, and make that phone call. And the burden of risk is on them. And when we have all these great resources. So I'm hoping that in the future we'll start to see policy allow RNs, MAs, health coaches, community health experts to get in there and support that patient before those symptoms become emergent.
I think a lot of it's driven by the opportunities. One real life example, we have our telemedicine solution in Watts in Los Angeles, which is a very urban area, very low socioeconomic status, and we put them in churches and Salvation Armies. In that particular population, 40% of the population does not see a primary care physician in 12 months. 17% doesn't see any healthcare professional, but they go to their church, their mosque, their synagogue, their community center. So I think a lot of it is going to be driven by the opportunities. And certainly there's access challenges. One area for hospitals that I think will be tremendously important, it's very, very expensive for those hospital systems that have locations in remote areas, very hard to get specialists, and to get locum tenens is a very expensive proposition. More and more I am hearing from hospitals that they want to provide access virtually and try to cut down on the cost of locum tenens, and I think that'll be an opportunity. But I think it's going to be driven by the opportunities. Now, I wanted to add another aspect to it. From our experiences, a lot of folks have utilized, various telehealth solutions. It's been like a checkbox. We're trying this, we're trying that, we're trying this, we're trying that. I'm sure Chris can share some stories there. But there hasn't been really a business model. There hasn't been really, what is the next step if this is actually successful? So I think one thing that's going to be defining for any organization is what is your connected health strategy moving forward. And you used a quote earlier, I'll use one from Steve Jobs, innovation distinguishes between a leader and a follower. Those folks that have a connected health strategy, those folks that can measure, manage, and optimize data and information, I think are going to have a significant advantage in this constantly evolving marketplace.
And just to stay on that topic, we're starting to see a lot of payer groups, value-based care companies that are looking at the alternative payment models, looking at steerage and navigation, and saying, we need to get a telehealth second opinion in at the primary care level before the train leaves the station and we're on a track to a surgical episode that might have been avoidable. Where do you see telehealth playing a role there?
So it's a huge opportunity. It just extends the primary care physician's practice and the hospital to get second opinions, to put that patient on symptom trackers, to do real-time evaluation of those symptoms and how they're progressing. I just want to make one more point about the reimbursement model. I had to laugh. I have one rental property, couldn't sell it, and so I had to get the garage door reprogrammed, and it was 15 minutes. I couldn't get there, so I had to pay for it. It was $87. And I'm hoping that we'll see payment for far more important services in the future than what you get to reprogram a garage.
To take your point, Joe, a step further, I really think where it's going to go, organizations are going to have a virtual multidisciplinary care team, doctors, nurses, specialists, pharmacists, diabetic educators, nutritionists, behavioral health specialists. I think ultimately that's where everyone would like to go. We're not there yet, but I think this fee-for-value world is certainly helping to accelerate that process. I'll give you a real-life example. There's an ACO that we're working with. They have 30,000 patients, and it's $300 million in revenue per year. 500 of those 30,000 patients cost $120 million. And so, if you could, be more closely monitoring those folks, and also in that situation, working on risk models. And I think that's been part of the issue is the business models for a lot of these folks, all those doctor on demand type of solutions and companies out there. None of them make money. They're all cash flow negative. And so, what is the business model? I will say it feels that very similar to the .com. So the digital health world today is very similar to the .com world from 1995 to 2000. 4,700 .com companies went public between 1995 and 2000. Today, only a handful of them are around, but they're massive. And that's how it feels. It's going to, over the next 10 years, the ones that are going to survive will be massive, and then they'll probably be the vast majority of them won't be around. So I think you have to go in with that kind of mindset as you think about these things.
One more point to that. I think some of the interesting things that can be done with that example is connecting health information exchange. So, connecting ADTs, CCDs, so that they do come back. So if that patient is out of state and that information needs to get back to their primary care provider because they're in a value-based contract or just because they want to treat that patient, having that integration, getting that information back and being able to do a real-time virtual visit, be synchronous or asynchronous is going to help move.
It's a great point. And the sad truth is that most of these telehealth tools up until this point have been used in, what I would call a concierge style, where the most vulnerable patient cohorts on the Medicaid end of the spectrum or the dual eligible end of the spectrum are left in this quagmire of uncertainty and lack of clarity around any kind of a reimbursement schedule. So how do you see social determinants of health weighing into this when you brought up the very good point that 5% of the patient population in many cases is driving 55% more of the cost?
Well, depending on whose numbers you believe, social determinants play up to, let's say, 70, 80% causality in people's health status. I mean, there's food, and nutritional status, there's housing, there's financial, there's transportation. These are real life issues, and if you don't address these issues, I don't care if you get them their drugs and supplies, they're not going to get better. One lane I think will get bigger, and it's kind of a diamond in the rough, in my opinion, medical nutritional therapy. I take care of a lot of or used to when I was practicing, take care of a lot of diabetic patients. Through J&B, we have one of the largest diabetic populations in the United States, so I kind of indirectly take care of those folks. But you get them their drugs, you get them their supplies, but if their nutritional status was not appropriate, they did not get better. So we've instituted a program where we can provide disease-specific food, and then there's also codes to do medical nutritional therapy. Rarely used, but I think a huge opportunity to be utilized. I mean, if you can get at the root cause, a diabetic patient not eating properly, they're going to have issues with their diabetes. I don't care how they test. I don't care if they take their drugs. And I think that's where we can leverage some of these technologies and some of these opportunities. And there are, a lot of codes out there that, I'm learning every day in regards to that. The other thing, I learned this recently. I'd be curious to see who's heard of 211, a 211 number. Okay, a lot of folks. I just learned about it recently, so I was. So for those that don't know, basically there's a number that people can call and get connected to community resources, just like 911 to call for an emergency. Well, again, I think there's opportunities when you talk about closing the loop. There's opportunities for screening folks virtually, and then also tying in other resources, because a lot of people that would call this number are probably a much higher prevalence of folks that would need, they have a harder time getting in to see their providers. They're kind of off the grid type of folks. And I also think a big opportunity with the social determinants is once you screen these folks, you can digitally activate these people, meaning a lot of them are off the grid right now. And so to update their demographic information and have the ability to connect with them, I think is another kind of very simple but important thing.
Yeah, I totally agree. In my previous role, I was responsible for doing all the analytics and implementing SDOH screening tools, and it was frustrating. One of my best employees was losing his hair because he was trying to match previous questionnaires. So I think there's a lot of work around standards in terms of question standards, question responses, codifying it, and I know there's some work going on out there. One thing I also think is the patient comes in once, maybe twice a year. I think the focus of social determinants should be not just in the office, but to your point, every day, any day. And so how do we get that feedback loop back to the care team, then get it back out to the community-based organizations who can do something about it? So an opportunity to build a hub that will receive and coordinate this is a huge opportunity we have in the state, and I'm sure we've got the right talent to do it.
Yeah, so before we open it up to questions, I'll ask one more question that has always been a little bit difficult around technology's fast-paced kind of Moore's law curve of evolution. The providers and their staff end up with the brunt of most of this technological advantage. But studies have shown that there hasn't been a ton of productivity that can be measured, and certainly not very many patient outcomes have been able to be measured, other than the mortality rate, which you could argue was curving in that direction anyway. So what is telehealth going to do differently, and how are we going to make it easier on providers that are thinking just right now, I would like to integrate this into my practice, but is this going to be another meaningful use exercise that costs me a ton of time and energy and doesn't deliver on its promises?
It's a great question. Implementing EMRs, they're struggling with getting their patient portal adoption up. So they have this tool that they can extend to patients that, in my opinion, in most cases is somewhat a dead end for a patient. It's not a consumer-based feature set. It's to check boxes off. It's to provide functionality. I think it is a struggle, because if they're motivated to do that, to check a box, to hit a target, how many more things can they take on? So I think the opportunity is building a solution that integrates properly to take as much burden off the people doing it. But the other big point, and we talk about telehealth as something a provider does, I think it's something that the whole care team should be involved in, and maybe not the provider, because the providers I talk to, one of the biggest concerns they have is they don't want to cannibalize a $140 visit for a $50, $60, $70 visit. So the question is, where do we use telehealth in the care model. I think that's going to be the challenge, and I think once we get past that point and we have the people and the process worked out, hopefully we can find reimbursement that eliminates higher cost episodes of care.
I want to leave some time for questions. One area that I think overall has been really surprising for me has been seeing how the ROI, the business case has been developed for a lot of these folks. So your point. So you have a doctor's group and you have 10 doctors in there. Well, you can go to any doctor in that practice and there's dead time. Patients cancel, they reschedule at the last minute, things happen. So my business case would be simple. You've got an hour here to kill. Why don't you jump into the queue and go do a virtual visit? Even if it's not $140, it's $70. So the other one, transitional care management. There's been a lot of progress around, and actually I remember Tim and I having this conversation a while ago. It's even progressed beyond that. I think that the thing that's lacking is the sustainability, the business case. We're not doing this to do it. It's not a science project. It's not telemedicine. It's not telehealth. It's healthcare. And when you think of it like that and you build the use case scenario and the business model around that, you can build something that's sustainable and scalable. The vast majority of things I've seen up to date have been really more a checkbox. We have this capability, and it doesn't really make money, but it's a nice to have. And I think the thinking, I've seen it come a long way. 5 years ago, there was a lot of folks saying, well, I'm not sure. We've been hearing about telemedicine for years and years and years. Now the conversation's different. The conversation's like, how do I make something happen? How do I do this? So I think the thinking is changing, but the way things are put together, it's not the technology that's going to move the needle. It's the integration, it's the business model, and I don't think it's as complicated as it's been made out to be up to this point.
Yeah, we're going to open it up to questions, and I do want to make the statement that that was a devil's advocate question. I certainly believe that there are plenty of studies that do show that there has been productivity and gains in patient outcomes. But does anybody have any questions for the panel?
Okay. Hi, Nick Disa from PHP right down the street here. We're a health plan, and you know, telemedicine is, I think, like the panel has talked about, where although it's been around for some 50 years almost, we're on the precipice of this big journey. And absolutely, there's a lot of legacy owners that are not ready for this disruption. But I have sort of two questions. One, especially for Dr. Shaya, if I'm saying that right. You said you're doing a lot of international telehealth. My curiosity is, are you finding more quicker adoption there because of less regulation around, you know, you have to be a Michigan doctor to see a Michigan patient, or you have to be in Illinois? I know we're working on PACS now with multi-state and stuff, but that's my first question. The second is, again, because we don't have all these devices that talk to each other or that everybody has, and yes, our iPhone or our Android phone can do a lot, but it doesn't necessarily do everything a physician may want in those visits. Do you see maybe behavioral health being at the forefront? Because, you know, the ability to talk or chat, which if someone's in that range of mental health, and having someone on demand 24/7, just to alleviate their current issue, which can mostly be done maybe with a conversation. Do you see that as maybe the leader in this area? So,
Dr. Shaya?
So thank you for the question, first and foremost. So a couple things. Internationally, number one, it's not a nice to have. So in most of these cases, it's this or nothing. So in Pakistan, either they get maternal fetal care from the site that we have, and by the way, they're the most remote, rural, undeveloped areas. There's no electricity, there's no internet. We use solar panels for electricity, we use satellite connectivity. So this is not a nice to have. So in a lot of places, it's either this or nothing. So that obviously is, you know, number one, is a big drive or need. Number two, the opportunity internationally is extremely great. I talked to someone, I went to go see the Gates Foundation, and we had a conversation, and they threw out a question to me. They said, who's got the most advanced telecom system in the world? And I'm thinking, United States? They're like, no, Kenya. I'm like, Kenya? Well, Kenya has a whole, everyone uses mobile there, and they have a super advanced digital wallet there. You can, do all your banking, you can do all your payments. So when they finally were able to afford a technology, they got the latest and greatest. They didn't have to displace something that's existing like we do here. So we're here, the changes have to be incremental. Over there, there's nothing to displace in these emerging markets. So the opportunities are very great. One last factoid there. By 2021, we're going to have 7 billion people connected by global Wi-Fi. So the opportunities to provide virtual care are great. The opportunities to change how we collect data and information globally are phenomenal, and that's a whole separate conversation. On the second part of your question, so you kind of, can you ask me that again in a kind of a, you kind of talked about a lot of things. Is there one particular part of that I can answer in a very short time?
Yeah, I was just asking if you thought behavioral health becomes...
Oh, yeah, behavioral health. Okay, so I will put it to you this way. I'll make a statement here to answer your question. Whoever can marry up virtual care technology, behavioral health, and social determinants, whoever can put that together, they have something so valuable. I mean, it's priceless in my opinion. That's where it needs to go. Tie in the behavioral health, the social determinants, and leveraging technology. Whoever can put that together, I think that's to me the holy grail. That's where you're going to really start getting to the root causes of a lot of these issues.
Do we have time for one more? Tim?
Yeah, Tim Pledger. Thank you. Great panel. Awesome discussion. Over the last couple of days, CMS Rule just closed that we even heard yesterday Andrew Rosenberg from U of M had a little consternation on that patients are going to get a much higher degree of access, that apps are in theory, finally going to get from both payers and from providers a whole new level of access. What impact do you think that will have on the sort of telehealth community and its ability to change the game, so to speak?
Cue chorus of angels for me, but Chris?
Yeah, I'll take a stab at it. I think to your point, the platform, the technology that can pull all those pieces together, that's what's important. And by giving patients/consumers the ability to pull in information from their payer, pull information in from the HIE, and get that information in real time, be able to share, maybe it's a connected device to your Apple Health that's streaming into your app that then gets shared to the HIE. There's a lot of questions and a lot of work to do around there, but I think that's when the app becomes valuable. Instead of you download the app one time because you did a visit with one of the national rent-a-doctor platforms, you forget you have it. It's got to be something that you use. It has multiple value points than just a connection to a doctor. And I think it's an opportunity and it has challenges, but I think that's going to be what really elevates this and moves this forward.
I agree. I know we're over time. I just wanted to reiterate my point earlier. This is going to continue. It's going to put gas in the fuel tank to continue the momentum of where things are going. 60 million virtual visits last year, 1 billion by 2020. So again, just reiterating that point. So I think it just helps continue to accelerate that. Look, it's changing times. I mean, Uber's one of the largest transportation companies in the world. They don't own any automobiles. Airbnb is one of the largest accommodation providers in the world. They don't own any real estate. Alibaba's one of the largest retailers in the world. They don't own any inventory. Healthcare is not immune to disruption. Just that's one thing, a take-home message. I know a lot of folks, and it's coming, but it's not here, and another 5 years. I've heard another 5 years for 20 years, so, healthcare is not immune to disruption. So those of us that embrace it, I think, are going to be ready for all the changes that are coming.
Many thanks to our panel, and thank you.